So we are officially leaving for San Diego today. It is 3:10 in the morning and it is way too early. As someone who's never flown, I'm kind of terrified, not gonna lie. But I have faith that everything will be fine. Surgery day isn't tomorrow, is tomorrow. And they said that right now it's projected for 3 p.m., but it could be sooner. So I'm gonna put this little nausea patch behind my ear. So I'm not gonna try to pronounce that, but you put it like right in this area, and it's supposed to help with nausea, like after anesthesia. And we're gonna put it on and hope for the best. I was told that it could also help with nausea, like for the plane ride and stuff. So we're gonna see what happens. I'm hella anxious now. Like, it's very surreal that it's happening. This all kind of happened very quickly. But the day is here that we are flying out. When I get to San Diego, I call the driver. We go over to Tijuana, and then I go in for like blood work, EKG, all that stuff. And as long as everything comes back normal, then we will continue on with surgery as planned, which is, like I said, Tuesday at 3 p.m. I'll keep y'all updated how this works. It should stay on, but you never know. So yeah, that's kind of just my little update for everybody. Stay tuned, because I'm sure I will be posting more about the flight and the content and all that stuff. And yeah, thanks for following me on my journey, and I will see y'all in the next one.
Alright, so we just arrived to the Detroit airport. Is where we're flying out of to board our flight to Chicago, where our layover is. We flew with Southwest because they have a wonderful program for plus size patients that actually, when you buy the first seat, you get the reimbursement for your second seat that you bought. So it was a great flight, good experience. This is going over Michigan and heading to Chicago right now. Flying into the Chicago Midway Airport.
Alright, we're here at the airport. So quite a morning. Started at 3 o'clock this morning. Got to Detroit, got delayed for 2.5 hours. Missed our connecting flight to Tijuana in Chicago. So now we're sitting here. What's up? This is Mercedes. So this is who I am traveling with right now to Tijuana so she can have her surgery. And right now we're just waiting until 4 to take off, and then we are on our way. How you feeling?
Excited but nervous.
Yeah, I'm excited for her, so I'm gonna keep you guys updated. Tomorrow's a big day, around 3 o'clock.
And that's what they have. They have 3 o'clock as the projected time, but it could be moved up sooner.
Alright, so the first question is, what made you decide on doing this?
So I've been thinking about it for years. Insurance never covered it. I was able to be in a spot where I was able to get it covered or like afford it. So I did some research, found a few places that I was interested in, and I landed on the Tijuana Geriatric Center.
Okay, cool. And what information have you found that's been pretty supporting or helpful so far during your process?
So I'm in a group for the bariatric center. The coordinators have been super helpful for the most part, and then Tia's been great. And then just doing some research on your own to kind of see what you're getting into.
Okay. And then what barriers have you had so far?
there's definitely a language barrier because we are going to Tijuana. They speak pretty good English, but sometimes some of the medications don't translate exactly. And then some of the things they tell you to do, it's kind of like without reason, or they're just like, hey, get this med, and they don't really give you much info on that. Other than that, I mean, everything's been pretty easygoing.
So when you have those barriers, what do you do to kind of get through it? Like with the language barrier?
Well, Google Translate's cool. But I'll like rephrase a question or like ask it in a way where they can either answer differently or I can understand differently. But there hasn't been like a major issue. Usually if I ask, they will
Good afternoon,
translate.
passengers. Welcome to Midway International Airport.
So this is us leaving Chicago. Snowy day. Had a little bit of a layover, but that's okay. And I got this really cool picture of downtown Chicago from the plane. I think it's so sweet. We got to San Diego in the evening time. It was about 8 o'clock because of our layover due to all the snow. But it was still beautiful out. Weather and everything was beautiful. And we checked into the Marriott Hotel once our driver came and got us. It was about 30 minutes from the airport, so the drive wasn't bad at all. The hotel was beautiful. We got a suite, which had a very nice shower. The tub was very low, so it wasn't like anything hard to get into or step over. The room had 2 queen-size beds, a great window view, everything that we needed. As soon as we got into the room, they ordered my patient her diet, which was just Clears, basically. But the bellboy, they were just so accommodating to everything that she needed. Right away, ordered her food so she had something to eat before midnight, and then just made sure she was comfortable.
Okay, so it's about 7:30 in the morning. Today's the day of surgery. It's February 18th, and surgery scheduled at 3, and we are getting ready now to go to the hospital, do the admission and blood work before the surgery. So I'll keep you guys updated.
So the hospital that we checked into was called Hospital CER. They actually do plastic surgery there, along with bariatric surgery. It's kind of a list of like all the doctors. Here's my patient filling out her paperwork. Once she filled out her paperwork, she had to go get some lab work done. Everything is right there, which is so nice. X-ray, labs, everything. We got up to her room, kind of got us checked in and did her vital signs, went over some paperwork. Here's the room, super clean. And here's my little patient. Super clean room, very comfortable. Had air conditioner, heating. Like it was literally spotless. The bathroom was really nice. Cable TV, like closet space, a safe in the room too. Also, if you need to lock up anything that's valuable. But it was very nice. They do not allow food into the rooms for the bariatric patient. Like you have to eat everything in the cafeteria. So that's another reason why the room is so clean. Also, they don't allow any food. You can have drinks, but they don't allow any food up on the floor where the bariatric patients are.
Hello, hello. Today is surgery day. Yesterday was a nightmare at the airport. Our flight from Detroit to Chicago was delayed, and we missed our connecting flight from Chicago to San Diego. So we waited at Chicago airport from like 8, maybe 9 in the morning until 4 p.m. So that was fun. We made it to San Diego about 7:30, and we made it to Tijuana by about 8. So it's been a long night. but surgery should be within a few hours. They said they're finishing up with one person and then I'm next. So I will keep y'all updated with what goes on. Bye guys.
Off to surgery now. The surgery actually took about 2 hours, and she was in recovery for a little less than an hour and came back up to the room. Did amazing. She had a little nausea, a little bit of pain that night. But other than that, this is the next day. Look how good she's like up and walking, preventing blood clots, helping her circulation, helping her feel better, getting up out of the bed and walking. So proud of her. We did multiple walks throughout the day. We had to stay on the unit, so we kind of just walked back and forth down the hallway. She did so good. And then this is a little view of the cafeteria. So this is where I would go down to eat my meals. And if you had meals that you wanted to save, you kind of leave it down there with your name on it. But it was a nice area too.
Alrighty. Okay, so today is post-op
Day 1.
and we gonna tell y'all what went down. But she made it. She alive. She's doing good. She done had the surgery. She can't believe it's done. Yes, we done. So, what happened after surgery?
So apparently, I was throwing a fit.
As expected, like, you know, it's uncomfortable.
The pain was horrible. Eventually they gave me morphine, and that's the magic charm right there. Put me out. So I woke up this morning, not feeling too bad. Walked around, it was like probably 2 in the morning. Walked around the room. I took a shower. I feel basically back to normal, but you do have to like relearn how to like swallow very small increments or you're gonna throw up.
So, with that being said, as you see behind us, these are all the drinks that hasn't been drinking. So, what would you tell people to expect on your first day after surgery?
Expect to drink a lot, as much as you can. Everybody's gonna be in and out the store, asking all these questions, taking your vitals, and I mean, mostly you're just chilling, walking the halls.
So she's still on antibiotics. She's still getting pain meds every 6 hours and nausea medicine. Everything's through the IV. But that's it. So she'll be on clear liquids for a week. So that back there where I showed you guys it is her meals for 1 week. And that's important to know because a lot of people don't expect that. After surgery, your stomach is
20% of what it was.
tiny. So it's important to know, like, you have to stick to that. And then slowly, what would be the next step?
The next step then is going to be protein shakes for a week, as well as clear liquids. You can have Jell-O, sugar-free. And then once you're kind of eased out of that phase, you go to soft foods. You go to pureed. You go to pureed food. So it's, you basically throw it into a blender, and it's very similar to like baby food, but don't buy baby food, obviously. And then that's like your week 3 to 4 until you're comfortable with moving on. And then you go to soft foods. So it's like you overcook some things so you can smash it down with a fork. Eggs, mashed potatoes, pretty much anything that you can like, it's like a mushy consistency. And then once you're confident with that, you move on to like a normal diet.
So that's the game plan for post-op day 1 is walking, drinking your fluids, at least 64 ounces, and getting ready to go. So tomorrow's discharge day, so we'll check back in tomorrow.
Bye guys.
Bye.
Dr. Garcia, who did the surgery, was a very, very nice surgeon. And this is Atalia. She's an RN, also the coordinator for the surgery center. This is post-op day 2. Look at her getting those stairs, getting her walking, preventing them blood clots. This is at the Marriott. They had a beautiful pool and hot tub area. Obviously, she couldn't get in the pool because of her incisions. She has about 5 incisions on her abdomen when they went in and did the sleeve. But she was able to get her feet in. The pool was nice and warm, very clean. And this is me sitting with her as we chilling by the pool, having a good old time. Okay, we are here. Post-op day 2. Quick update. Alright, what you gotta say?
So, after the hospital, we got discharged today. It was probably about 10 in the morning. They sent us to the pharmacy to pick up like some antacid meds, a blood thinner, and
like anti-ulcer medication.
Anti-ulcer medication. And that wasn't too bad. After the pharmacy, our driver brought us back to the hotel. It's the same one we've been staying at. And we walked around a little bit, hung out for a bit, ordered some food. And by food, I mean a popsicle. And there's a pool here that we discovered. So we went down to the pool probably a few hours later. Put my little feet in. Then there was a jacuzzi. Again, not getting the actual incisions wet to lower the risk of infection.
Yeah, just your toes.
Just my feet.
Yeah. And then came back and ate
we've
dinner,
been walking
all around. She's doing so good. How's your pain today?
It's minimal.
Okay.
Maybe a 2 out of 10.
Okay. And where are you having a lot of pain at?
It's just on the one incision that's on my far left side. And it could be, that they were pulling extra there, or, there was extra, whatever you want to call it.
Like when they were doing the surgery, like the extra manipulation.
Just the one incision.
Mm-hmm. So post-op day 2 in the books. All done. Tomorrow, what we doing tomorrow? Leaving?
Waking up way too early.
Yeah.
Headed to the airport about 9 o'clock in the morning. Our flight's not until 1:20, but we will fly back from San Diego to Chicago to Detroit, back home.
Mm-hmm.
And
when you leave Tijuana, you go through border patrol, and those lines be crazy. And with it being 9 o'clock in the morning on Friday, it's gonna be even more crazier with traffic and everything. So that's why they recommend you leave like 4 hours early to get to your flight on time. So that's just something else to keep in mind. But we're gonna check in tomorrow and kind of go over like what Mercedes spent on everything, and which is actually pretty darn good. But that's it for tonight.
we finna go to bed. We gotta wake up early.
Yeah. All right. See y'all.
Bye, guys.